Now, I can't obviously follow on from David. I'd like to think he was my warm-up act to get you in the mood. And I don't want to build your hopes up, but I come from Ireland too. I'm originally from Sligo on the west coast. I came out here, thank you, must be one of my aunts, is it? I come from a very big family. My father's one of 12, my mother's one of 13. So I came to get away from them. I came here for 6 months in 1988. And I arrived on the day of the bicentenary, which I knew nothing about, on a Tuesday. And myself and my husband, we went down to Circular Quay and found 100,000 people blind drunk at 11:30 on a Tuesday morning. And we said, well, this is the play. Imagine what the weekends are going to be like. So here we are. And after you'd gone to such effort for us, you know, to make us feel welcome on that day, we felt obliged to stay and contribute, really. I mean, some bunting would have been nice, or a band at the airport, but seeing as you went to such an effort for us, we're very grateful and we've stayed. So I would like to acknowledge the traditional owners of the land on which we meet, the Aboriginal people of the Bundjalung Nation, and pay my respects to their elders past, present and emerging, and to any Aboriginal or Torres Strait Islanders who are here today. The title of my talk is Invisible Nurses, the missing piece of the puzzle. I'd like to thank you for inviting the New South Wales Nurses and Midwives Association to contribute to this very important conference. I've been asked to represent Brett Holmes, the General Secretary, and the Council of our association, who are delighted to be a sponsor of this event. The New South Wales Nurses and Midwives Association is the registered union for all nurses and midwives in New South Wales. The membership of the association compromises all those who perform nursing and midwifery work. This includes registered nurses, enrolled nurses, and midwives at all levels, including management and education, and assistants in nursing. The association has approximately 64,500 members and is affiliated to Unions New South Wales and the Australian Council of Trade Unions, the ACTU. The NSWNMA are also the New South Wales branch of the Australian Nursing and Midwifery Federation, the ANMF. Our role is to protect and advance the interests of nurses and midwives and the nursing and midwifery professions. We're the founding members of Global Nurses United, covering nursing unions in Argentina, Australia, Brazil, Canada, Costa Rica, the Dominican Republic, Guatemala, Honduras, Ireland, Israel, the Philippines, South Africa, South Korea, and the United States. The ANMF is Australia's largest national union and professional nursing and midwifery organisation. In collaboration with the ANMF's 8 state and territory branches, we represent the professional, industrial, and political interests of more than 275,000 nurses, midwives, and carers across the country. Our strong and growing membership and integrated role as both a trade union and professional organisation provide us with a complete understanding of all aspects of the nursing and midwifery professions and see us uniquely placed to defend and advance our professions. Through our work with members, we aim to strengthen the contribution of nursing and midwifery to improving Australia's health and aged care systems and the health of our national and global communities. We're also committed to improving standards of patient care and the quality of services in health and aged care services. The New South Wales Nurses and Midwives Association are very proud to be associated with and support the work of United in Compassion. Firstly, I'd like to thank very much Lucy Haslam and the Board of United in Compassion for inviting the association. Yes, let's thank Lucy. Brett Holmes, our General Secretary, sends his apologies that he's not able to attend in person, but he's otherwise engaged with the state election, which is on this weekend in New South Wales, where the Nurses Association members are campaigning across the state for nurse-to-patient ratios for safe patient care. So these are our core values, and I think that they fit well with any campaigning around medicinal cannabis. I was delighted to represent Brett, as medicinal cannabis is an area which I have a great interest in. In just over a year, our association held 4 forums in Sydney, Wollongong, Newcastle and Coffs Harbour on the topic of medicinal cannabis for nurses. We had almost 400 nurses who attended these events, and we were surprised by the demand and the interest. Local media covered the forums and were always keen to interview the local nurses. These were quotes from the reports that we put together. Last year, I was invited by the New South Wales Office of Medicinal Cannabis to a meeting of international regulatory authorities. As far as I am aware, I was the only nursing representative at a large day-long meeting. Just before that event, I was talking to one of the organisers who mentioned they were busy planning this event with all the stakeholder groups. I asked which nursing groups were invited, and they looked at me absolutely incredulously. I inquired if it was an oversight or a deliberate strategy not to engage nurses, as I think they are key stakeholders in this space. During the course of the day's proceedings, there was a panel discussion with experts from the regulatory bodies from Germany, the Netherlands, Israel, and Canada. I asked the panel if they had conferred with any nursing groups in their own countries when setting up the regulations or the policy or the enforcement bodies, and none of them had. And again, they looked surprised by the suggestion, and they agreed that it might have been an oversight. So that led me to wonder about the level of engagement of nurses in the medicinal cannabis space and to the association holding these small number of regional forums, which I mentioned, and the reports, to test the interest levels. They were low-key and aimed at our members. We surveyed the attendees from each forum and compiled a report following each event, and it was obvious that nurses were interested, engaged, and incredibly keen for more information. And I'd like to acknowledge that Lucy spoke at these, Carol Ireland from Epilepsy Action, Justine, Dr. Topek. People generously gave of their time and expertise to share it. Nurses are first and foremost patient advocates. They see this as a vital component of their role. They spend a lot of face-to-face time around the clock with patients and their families. The nurses usually build a rapport and understand their patients and the challenges and fears they face. There is a great bond between nurses and their patients. It's not a surprise, then, that year after year, nurses top the list of the most trusted professionals. My apologies to my medical colleagues here. And they make up the single largest group of health workers. They work in public and private hospitals, in the communities, in schools, in prisons, in refugee services, in aged care. They work in every clinical specialty: mental health, ICU, pediatrics, aged care, oncology and hematology, medical, surgical, perioperative. On it goes. This was one of my favourite campaign slogans that we had in the past with a joint New South Wales and Nurses Association initiative: nurses, we can't live without them. I think that sums it up very well. So where are the nurses today in the medicinal cannabis campaigns? Where are they in the policy and advocacy development around medicinal cannabis? Why are the laws and research being developed with, at best, minimal input from nurses? Where are the nursing academics in developing nursing-specific courses in all areas of medicinal cannabis? Where are the schools of nursing in educating about medicinal cannabis and the endocannabinoid system? Perhaps they are already active in this area, but their work is not highly visible. We are involved in very early discussions with some nursing academics who are also members of the New South Wales Nurses and New South Wales Nurses and Midwives Association, by the way, about developing some specific medicinal nursing courses written for and by nurses. Why are nurses totally invisible in the developing medicinal cannabis arena? We're surely the missing piece of the puzzle. Not only are we already well organised and networked, both nationally and internationally, we are educated and informed, and there is a great unmet need for more information and education for nurses. We are the ones who are often asked by patients about the role and suitability of medicinal cannabis products for their conditions. We cannot give factual and up-to-date advice in this rapidly changing landscape without having access to the most up-to-date education and information. Nurses are powerful and understand the importance of safe, affordable medical care for all their patients. Nurses also need to be aware of their own role in the medicinal cannabis field. What are the legal and professional guidelines within their regulatory bodies? What happens if a patient is admitted to my ward with medicinal cannabis? What are my rights and responsibilities? The New South Wales Nurses and Midwives Association and our other ANMF branches each sit on the representative regulatory bodies in each of the state and territories. We also represent nurses who find themselves in front of those regulatory bodies. So nurses must know what they can and cannot do. They must work within the legal framework and their scope of practice. Excuse me. For those reasons, I believe that nurses must be involved in formulating and developing laws and policy in health, not just in reacting to them when they are introduced. I have had a number of discussions with nurses in countries who are currently actively involved in medicinal cannabis. Nurses from Israel and America spoke at our last forum, and there is a huge appetite for nurses to hear directly from other nurses with experience in this area. We don't need to reinvent the wheel. We can learn from our colleagues overseas what worked and what didn't work, and why. We have the ability to harness a large network of nurses across Australia. We can share expertise, experiences, stories, and skills, both across Australia and with nursing networks around the world. We have already established networks with nursing groups in Canada, in America, in Europe, and in South America. We need to bring our nurses into the medical cannabis arena. The New South Wales Nurses and Midwives Association and the other ANMF branches across the country are in a great position to do just that. We will aim to launch a cannabis nursing movement by holding a national cannabis nursing conference here in New South Wales, hopefully in the next 12 months. We will hope to launch the first nursing-specific medicinal cannabis course at that conference. We will engage the nursing profession and harness their power to work for the alleviation of suffering. This will be a world first, literally history in the making. Will you join with us? Nurses are very effective at lobbying and bringing the public with them. You need look no further than at the magnificent Lucy Haslam, herself a retired nurse, and look at what she has achieved on her own. Imagine having hundreds of tiny mini Lucy clones. Horrifying, isn't it? Involving the wider nursing profession has untapped potential for helping to bring medicinal cannabis to those who can and should benefit from it all. We have the support of the largest trade union and professional nursing organisation in this country, but we're going to have to find sponsors to fund this conference to launch the power of nurses in this area. We need to bring nurses together to I self-monitor. We need to bring nurses together to share their stories and their research. We need to engage nurses to do what they do best, to advocate for their patients. Nurses recognise and respond to patient needs. Their compassion is not being harnessed at the moment. Over the next 3 days, I hope to be able to forge networks with many of the groups here who share the same vision as us to engage nurses. So please come and talk to me if you're interested in being involved or sponsoring a future event. The NSWNMA is a leading and visionary group of nurses, so we invite you to join with us to make it happen. We hope that there is interest and the will to support us in making this happen and making it happen soon. Let's make nurses a highly visible force in this area and fix that missing piece of the jigsaw puzzle. Thank you.